Women who have pregnancy complications may feel relieved when a healthy delivery is in the past, but if you had high blood pressure during pregnancy, you may want to let your post-pregnancy physician know. I'm Jennifer Dodd, and this is a Daily RX Minute. A recent study found that women who had pregnancy complications related to high blood pressure were more likely to have risk factors related to heart disease and diabetes a few years after giving birth than women who didn't have high blood pressure during pregnancy. Tell your primary care doctor if you had preeclampsia. For Daily RX TV, I'm Jennifer Dodd.
Allergies is an immune system disorder that occurs when the immune system is overly sensitive to certain non-disease-causing substances called allergens. Allergies can be described as a false alarm of the immune system. Allergies can cause a variety of minor symptoms, including runny nose, itching, swelling, or sneezing. However, some severe allergies can cause hives, trigger asthma attacks, or create life-threatening breathing problems. Some common allergens include pollen, pet dander, insect stings, certain food, and certain medication. Family history of allergies, a lack of early childhood exposure to allergens, and young age may increase the risk of developing allergies. Treatments include many over-the-counter antihistamines, including cetirizine, fexofenadine, and loratadine. Prescription steroids, including prednisone and methylprednisolone, have also been used to treat severe allergies. Allergy shots, also known as desensitization therapy, is often effective at preventing allergies. The easiest way to prevent allergies is to simply avoid the offending allergen. Wash hands and clothes thoroughly after touching a known allergen. Know and avoid drug and food allergies and exercise caution whenever there is a chance you may be exposed to serious allergy triggers.
Women typically go through menopause in their early 50s. However, could hitting menopause at an earlier age reap serious health risks? I'm Sonia Singh with your latest health news. A recent study found that women who went through early natural menopause between ages 40 and 45 were at an increased risk for heart failure, more so than women who went through menopause in their 50s. Researchers found that smoking tobacco increased the risk of heart failure for women who went through early menopause, as well as those who went through menopause at ages 46 to 49. Speak with your doctor to gain more insight into the risks associated with early menopause.
Diabetes is a condition where blood sugar levels remain higher than normal. There are two main types of diabetes. In type 1 diabetes, the body attacks cells that normally produce insulin. In type 2 diabetes, the body does not make or use insulin the way it should. Insulin is a hormone that helps the body use sugar for energy. In diabetes, problems with insulin causes sugar to stay in the blood. Another form of diabetes that mainly affects pregnant women is known as gestational diabetes. Symptoms of diabetes include increased thirst, frequent urination, fatigue, blurred vision, frequent infections. Age, family history, race, diet, and lack of exercise may increase the risk of developing diabetes. Over time, having too much glucose in the blood can cause damage to the eyes, kidneys, and nerves. Diabetes is also a risk factor for many other conditions, including infection, heart disease, and liver problems. There are many different medications that can help treat diabetes. Oral anti-diabetic medications like metformin and glipizide are effective in keeping blood sugars in check, and injectable insulins are often used to help the body use blood sugars normally again. Eating a healthy diet, maintaining a healthy weight, and exercising can help control diabetes. It's important for diabetics to routinely check their blood sugars, take medications on time, and get regular checkups to watch out for complications.
All people who have diabetes are also at risk for heart disease, but one gender may face a higher risk than the other. I'm Mindy Cook with your latest health news. A recent study found that women with type 2 diabetes had higher systolic blood pressures and higher LDL, or bad cholesterol levels, than men. Both high blood pressure and high LDL cholesterol are risk factors for heart disease. The risk of death from cardiovascular disease is 2 to 4 times higher among people with diabetes. If you have diabetes, discuss your heart health with a cardiologist.
Hey Doc, answers to questions you never thought to ask about the new health insurance marketplace.
Hey Doc, what are deductibles, co-insurance, and co-payments?
Oh boy, are you sure you want to buy insurance on the marketplace, my friend? Seriously, there's a lot to learn, but I'll try to be a patient teacher. Get it? A patient teacher? Sorry about that. Here we go. Deductibles, co-insurance, and co-payments are your share of the cost of your health care. First, the deductible. That's how much you have to pay first before your insurance starts to cover much of your health care costs. If you have $1,000 deductible, then you have to pay the first $1,000 of your medical expenses before the insurance company helps pick up the rest. You would meet that deductible once a year. It starts all over again when you renew your insurance for another year. Next, the co-insurance. This is what share of a specific medical bill you have to pay usually after you've met the deductible. Let's say it costs $100 for an x-ray and your co-insurance is 20%. You would pay $20 of that cost. Your insurance would pay the rest, $80. Your co-insurance will depend on the plan you pick and whether you get your services from a doctor or hospital that's in or out of your plan. Then, every time you visit the doctor, you'll pay a co-payment. It's usually a fixed fee, like $25, that you pay before each visit. It's not something you split with your insurance plan. For answers to more of your questions, stay tuned or go to healthcare.gov or becoveredtexas.org or heydoc.texmed.org. For the Texas Medical Association, I'm Carlos Hey Doc Cardenas.
Physical activity and exercise are typically recommended as part of a healthy lifestyle. Yet for some, there may be such thing as too much exercise. I'm Kendra Rowland with your latest health news. Recent studies looked at the relationship between exercise and heart health. Researchers tracked the physical activity habits of patients with heart disease. They found that patients who exercised moderately had the lowest rates of stroke and heart attack compared to inactive and very active patients. Another study found that in men, vigorous exercise at age 30, followed by sedentary habits by age 60, was tied to increased risk of irregular heartbeat. Work with your doctor to find a healthy fitness plan.
Staying physically active is important for everyone, even for adults who cope with disabilities. And a new report suggests that many of these adults aren't getting enough activity. I'm Erin White with your latest health news. According to the new report from the CDC, around half of adults with a disability did not get any physical activity. The report suggests that this lack of physical activity may contribute to an increased risk of chronic diseases like cancer, diabetes, and heart disease. Luckily, however, it seems that a doctor's recommendation may help, as the report found that these adults were 82% more likely to get physical activity if their doctor recommended it to them. Ask a doctor about exercise that is safe and effective for you and your condition.
Chronic pain disorders form a family of conditions where patients suffer from pain that can last for weeks, months, or even years. Chronic pain disorders have a variety of possible causes, including injury, infection, cancer, and nerve problems. Sometimes chronic pain has no clear cause or may be the result of multiple causes. Strenuous physical activity, a history of serious injury, mental health issues, and many other factors can increase the risk for chronic pain. Managing chronic pain often requires time and multiple checkups to develop an effective treatment plan. Luckily, treatments are geared towards decreasing pain and how often pain occurs, and this can help limit symptoms. Medications such as pain relievers, antidepressants, and anticonvulsants are often effective at relieving different kinds of pain. Other treatments include physical therapy, psychotherapy, and behavior modification. In some cases, surgery or other major treatment options may be needed to address the cause of pain. Living with chronic pain can often become a challenge. Do not get discouraged if treatment does not work, as well as initially. Many chronic pain disorders are treated gradually or may require changes to your treatment over time. Work with your healthcare providers to make sure your treatment plan is working for you.
Vaccination rates among teens for several vaccines may be up, but HPV vaccine rates are slowing. I'm Teresa Brucker, and this is a Daily Rx Minute. A recent report by the CDC found that vaccination rates for several important shots have been increasing among teens. Vaccination rates for tetanus, diphtheria, and pertussis, as well as for meningococcal disease, have increased since 2011. However, rates for girls getting the HPV vaccine have lagged. Follow the CDC recommended immunization schedule and talk to your doctor about vaccinations for your teens. For Daily Rx TV, I'm Teresa Brucker.
Alcohol is consumed by many people around the world on a daily basis. However, how widespread is the impact? I'm Sonia Singh with your latest health news. According to the World Health Organization, or WHO, harmful alcohol consumption killed over 3 million people worldwide in 2012. Alcohol consumption is not only related to dependence and addiction, but is also tied to an increased risk of over 200 health conditions, social and economic losses, and violence and injuries. Speak with your doctor to learn more about the hazards associated with harmful alcohol consumption.
Parents want to keep their children safe and healthy. So Dr. Ari Brown reminds her patients that vaccines are important, safe, and effective.
The truth is that vaccines are very safe and vaccines do their job. And the diseases that they are protecting against are quite real.
That's why doctors of the Texas Medical Association started the Be Wise Immunize program. They've given more than 100,000 free or low-cost shots to Texas children.
Vaccines have been one of the most important ways that we've been able to prevent serious illness and death in children.
Texas Medical Association, improving the health of all Texans.
Low testosterone is a decrease in testosterone levels to a point below what the body needs to function normally. Signs of low testosterone include decreased sex drive or libido, decreased muscle mass, mood changes, inability to concentrate, and other various symptoms. Obesity, certain medications, and injury or illness affecting the testes can lead to low testosterone. Testosterone levels also decrease naturally as men age. For some men, a significant drop in testosterone may require treatment. Low testosterone can be treated with testosterone replacement therapy, which is available in many different formulations, including creams, including Androgen Fortesta, and capsules. However, testosterone treatment is not for everyone. Factors that determine treatment including the level of testosterone, the cause of the low levels, and the underlying medical condition. Doctors often recommend that men with low testosterone eat a healthy diet, lose weight if needed, limit alcohol, and reduce stress.
No matter your gender, certain risks can increase from smoking cigarettes. I'm Lindsay Morrison, and this is a Daily RX Minute. According to researchers, it's estimated that across the globe, 6% of deaths among women and 12% of deaths among men each year can be linked to tobacco use. A recent review showed that the risk of stroke was similar among men and women smokers. Fortunately, however, former smokers had a lower risk of stroke compared to current smokers. Quit smoking today to lower your stroke risk. For Daily RX TV, I'm Lindsay Morrison.
Lice are parasitic insects that can sometimes be found on the heads and bodies of certain patients. Lice can cause intense itching and small red bumps on the scalp, neck, and shoulders. In addition, lice eggs or crawling lice may be visible in the hair or on the skin. There are 3 common forms of lice, including head lice, body lice, and pubic lice, sometimes known as crabs. Lice are easily spread through close personal contact and by sharing belongings with people who have lice. Even though lice most typically affect school children, lice can affect people of all ages. Lice are not spread by pets, nor can they hop or fly to new hosts. Both over-the-counter and prescription medications are available to treat cases of lice. Over-the-counter medications like Nix and Rid are available as shampoos, lotions, and rinses. Prescription medication, including Sklice, is available as well for cases that are hard to treat. Keep people with lice away from others until they can be properly treated. Maintain proper hygiene to avoid lice. Always remember to wash all clothes and bed sheets with hot water and detergent if you find someone close to you has had lice, as lice can sometimes survive on household items for long periods of time.
Eating more frequent, smaller meals in a day has often been seen as a way to control weight and boost metabolism, and many diabetes patients use this practice. New research, however, found that a different option may be better for these patients. I'm Kendra Rowland with your latest health news. Some studies have suggested that eating 5 or 6 smaller meals in a day may lead to modest health improvements. However, recent studies have shown that eating 2 large meals a day may be better for managing weight and blood sugar for patients with diabetes. Ask your doctor about healthy eating habits.
It may seem harmless to pop a multivitamin each day, but dietary supplements still contain active ingredients that affect the body. They might also interact with prescription medications. I'm Erin White with your latest health news. A recent study found that about 1 in every 3 adults took both dietary supplements and prescription medications simultaneously. Taking supplements like multivitamins, especially those with added herbs or fish oil, may interfere with prescription medications. Therefore, doctors need to be aware of all the supplements that their patients may be taking if the patient is taking prescription medications. Tell your doctor about the supplements you take.
Hey to questions you never thought to ask about the new health insurance marketplace.
Hey doc, my doctor can't get a straight answer from my insurance company. How do I know if I can use my insurance?
These kinds of hassles can be so frustrating for both doctors and our patients, my friend. They surely get in the way of good medical care. Here are a few tips that can make it a little bit easier for all of us. First, before you visit the doctor's office, pay your premiums on time so that your insurance takes effect. Just signing up is not enough. Also, make sure you write down the member ID number you receive when you sign up for insurance and bring your ID card with you when you come to the doctor. You'll need that number so you or your doctor can check what kind of benefits you have. Finally, you can find out what's covered and how much you might have to pay by calling your insurance company or using a special website that some health plans have set up. Your ID card should have the phone number and the web address. For answers to more of your questions, stay tuned or go to healthcare.gov or becoveredtexas.org or heydoc.texmed.org. For the Texas Medical Association, I'm Carlos Hey Doc Cardenas.
Chronic myelogenous leukemia, also known as CML, is cancer that involves an abnormal gradual buildup of white blood cells. In healthy patients, a tissue inside of the bones called bone marrow creates new blood cells, including white blood cells. Patients with CML have bone marrow that produces too many of a specific type of white blood cell called granulocytes too quickly. These immature cells flood the blood and make it difficult for healthy blood cells to work properly. The cause of CML is not really well understood, but many patients with CML have a specific mutation called Philadelphia chromosome. Other risk factors including being a male, exposure to radiation, and other environmental factors. Symptoms of CML include extreme fatigue, weight loss, fever, and pain or feeling of fullness below the ribs on the left side of the body, where the spleen is located. CML treatment often involves a bone marrow transplant to replace the malfunctioning bone marrow tissue. Certain medications, including tyrosine kinase inhibitors, immunosuppressants, and interferons, can help decrease symptoms and the overproduction of white blood cells. Like many cancers, early detection is important to the success of CML treatment. It is very important that CML patients follow treatment and follow up directions closely to get the most out of their treatment.
Kids who don't get enough sleep might drive their parents crazy sometimes, but there could be more at stake. Kids' waistlines could suffer too. I'm Mindy Cook with your latest health news. A recent study found that children getting the least amount of sleep through early childhood were most likely to be obese. From infancy through age 7, children getting too little sleep had larger hip and waist measurements and greater fat mass. Be sure your child is getting enough sleep at night.